Minister, look, Ireland is a very modern country. We are one of the global exporters in terms of software, but unfortunately, when it comes to the adoption of digital health, we are a laggard. And look, I think it is important that we acknowledge that part of that problem is down to us here in this House, and the way that we handled as politicians the whole PPARS debacle, which had a chilling effect on the development of health services, digital health services here in Ireland. Now, Minister, I'm going to flag a few issues, but I'm also going to do something unusual and provide you with some solutions in relation to it as well, rather than just flagging problems. But I think overall, our health service, it has many challenges, and I am absolutely convinced that e-health has the ability to radically improve the delivery of health services in this country for individuals and the overall performance of our health service. I believe that it can dramatically accelerate the delivery of sláinte care, and I fully support both sláinte care and the principle behind what is here before us today. I think having electronic health records for everyone in the country will enable a better care for everyone and make our health system much more efficient, much more effective, and, believe it or not, save money within our health service. And speaking of the issue of saving money, one of the pieces of low-hanging fruit in relation to where we could save money is in the management and transfer of medical records. And I think a number of speakers have spoken here in the House about paper records and paper records going missing. But even the phenomenal cost in managing those, the administration cost, something that I asked the HSE for, and the HSE came back to me and said that the HSE's record retention policy states that each individual hospital makes its own arrangements in relation to the storage and management of records. So we don't even know the phenomenal cost that this is on an ongoing basis. Now, as you know, Minister, speaking of the issue of records, I raised an issue here yesterday in the House, which really concerns me, and that's in relation to genetic tests that are leaving this country, going to the United States, going to the UK, going to France, Spain, Germany and Finland for genomic testing. And I raised a specific concern about how the genetic information that is being gleaned from those samples is being handled and managed. Now, I know the Minister yesterday dismissed it, and I don't think he fully understood the point that it was making. Absolutely, look, if I send a genetic sample away and it goes through either the Children's Hospital in Crumlin or St James's Hospital in Dublin for analysis to some of these labs to test for something, they'll come back and give me a result. But all that comes back from these labs is the actual result. The genetic data remains in those jurisdictions, which are outside of GDPR, are outside the proposed European health data space. And I have no idea how my data is being used for secondary purposes. And neither does the HSE or neither does the clinicians here in Ireland. And as I say, there is an opportunity to bring those back onto the island and into our own control here, as well as providing those results in a far more timely manner. Now, not even going as far as the issue of e-health. And as we know now, because every single home in Ireland is getting a fibre optic cable, there are massive opportunities in terms of telehealth in this country. And I've questioned the HSE on the progress they've been making, particularly since COVID, and even within your own remit, Minister, in the mental health areas. And the response I got back last June from the HSE is that telecare figures are in their infancy. There's a small number of pilots in use. However, there aren't any national figures available. And then the HSE goes on to mention a few small pilots on remote health monitoring, online support and therapies, and remote health consultations. Now, that is an area, Minister, where we can roll these services out very quickly, improve the quality and responsiveness of our health service, reduce the amount of times that patients need to travel to meet clinicians, ensure that they attend these appointments more frequently, and make our health service far more efficient. And it is disappointing that we're not being far more proactive in relation to that. And that isn't and doesn't require a change in the primary legislation that we're talking about here. Now, I know that one of the provisions of this particular piece of legislation is to deliver on the European health data space, and it's an issue that I flagged, that the need for us to be part of this at European level. And one of the primary purposes of that, and I believe probably one of the motivating factors for the enactment of this legislation, is that it will give individuals and healthcare professionals the right to access and use personal health data. And I think, look, it is a positive point. But as you know, Minister, there have been concerns expressed by people as to who is actually going to control that. And will patients have opt-outs in relation to it? And Minister, I think we should circumvent all of this. I have a device here in my hand that can easily hold all of my health records. And then I decide who has access to it, and I decide what information they have access to it, and I carry this around with me. So it's not the case that if I go out onto Kildare Street here and an emergency happens and an ambulance needs to be called, there is no reason why the ambulance services could not be able to access the relevant data to them in my pocket. And what we should be doing is giving control to individuals, putting the information on the device, and then let the various clinicians read the relevant information to them. I do not want to see a situation happen that if I'm under the care of the mental health services and I go into an acute hospital and someone decides to be curious as to what other medical records that are on it and access them. But that wouldn't happen if I control that information and control it on the device. Now, Minister, you'll turn around to me and say, that's all well and good for me that uses a smartphone. But what about the people that don't? And the easy way around that is the vast majority of people that don't use one of these have a PPS card and they carry the chip with them. Either that card can be altered to put a second storage device on it, or a second health card. A lot of them already have access to medical cards and so forth. A simple card and chip can hold the exact same data, and it can ensure that whether you're 8 or 80 or 8 months, that the individual or their guardian has control over who accesses that information, not any third parties. And I think it would be important to do that. The other thing, Minister, that will be provided for in terms of the European health space is to provide for the use of medical data for education, scientific research and so forth. And I think this is important. It does preclude the access of that for insurance purposes, and that is important. And the reason it's important is that we introduced a piece of legislation, and I was in government at the time when it came in, the EU's GDPR, and it has now become the effective global benchmark for personal data. But it has its problems, and one of those problems has been the issue of medical data. Because even when access to that medical data can benefit an individual or a cohort of particular patients, at the moment, because of the way GDPR is interpreted, that information, even if it's a large anonymised pool of data, cannot be used. And I'll give you a practical example of it, and that is cystic fibrosis patients here in Ireland. We cannot develop innovative treatments to target specific cystic fibrosis conditions or symptoms, because we have to get consent before the data is collected, and you can't then go retrospectively back logistically and do that. Now, while the European health data space will address this issue from this point forward, it doesn't deal with the retrospective access issues. And I believe, Minister, that we should, in tandem with this legislation, bringing forward a further provision, and that is to establish either data trusts or data cooperatives. And what I mean by that is that if, for example, take myself, I'm a celiac. So if I want and allow for information that could benefit me or every other celiac in this country, I should be able to allow that data to be used. Now, some new innovative solution will come forward that was never contemplated at the time that I consented to that. But I should, at the time of consent, be allowed to consent to have a data trust established. And that would be a group of my peers, a small number of people in a similar situation to me, that can be consulted and engaged with and asked, will you give your consent to the use of this information for a specific purpose? And that they could act on my behalf to do that authorisation, rather than going back to every single individual that had provided the data in the first place. And it is a way to provide the type of safety net that we all want to see in place, but also ensure that that data is used for positive, constructive, beneficial research for every single different cohort of patients, be they a large cohort or a small cohort of patients. And that could easily be regulated and managed through this House in terms of those appointments, so that you have a democratic element to that. You provide that transparency in relation to it. But I have, Minister, a real concern, and I've spoken to colleagues internationally in relation to this. I have a real concern in relation to the European health data space and its transnational implications. So the proposal, as we know, will strengthen health data protection and research, not just in Europe, but across the world. However, it has ramifications, and I think unforeseen consequences for third countries looking towards Europe for innovation and research collaborations. This impact may be felt strongest by certain countries in Africa, many of which are lacking the existing regulatory frameworks and technological infrastructures needed to comply with the health data space requirements. Now, if we look back in terms of the EU's GDPR, when that was adopted, the approach that was taken at the time was a take it or leave it approach. So third countries that wanted to engage with digital users in Europe had to either comply with GDPR's expansive data obligations or lose their existing access to the world's biggest market. And that's all well and good if we're talking about it from a commercial point of view. But in developing nations, this could have a big negative impact in terms of data imperialism and effectively add obstacles to several African nations accessing unique services in Europe because of the way this data space is being interpreted. And I believe that these extraterritorial powers that we've seen in relation to GDPR are now going to be reflected in the European health data space and could jeopardise the dynamism, the economic growth and health systems for many African countries with this one-size-fits-all approach to health data. And I think this Europeanisation of African health systems could impose unnecessary levels of bureaucracy on an EU-centric health data approach to the delivery of health services in many developing nations. And I would express severe concern over the approach that's been taken. And we do need to find a middle ground in relation to it. Absolutely, I believe that we need a belt and braces approach here in Europe. But that should not freeze out developing nations and developing countries in getting access to innovative solutions here in Europe. And we do need to look at that. And I would ask, Minister, that our own Department of Health and that the Irish Government would articulate that on behalf of these countries. I don't think Deputy Murphy has arrived yet, so there's two other points that I want to raise. Unless, if she does come in, you might let me know. But there's two other points I want to raise, Minister. The first one is in relation to cybersecurity issues. And, you know, the health system is only going to be as good as the weakest link within that digital space. And it's not just going to be within the health system, because the way our society works, everything is connected to everything else. And we need to have a very robust cybersecurity system throughout this country, from the smallest business in Ireland right through to the social welfare system and our health system. And I believe that SMEs in this country, Minister, are the weakest link in that today. And I spoke to the Minister for Finance and the Minister for Public Expenditure and Reform yesterday evening, and I made this point to them. Now, we actually have a good model here in this country in terms of the Trading Online Voucher Scheme, which encourages small businesses to start trading online. And I think a similar scheme should be introduced for small businesses in this country to up their cybersecurity standards, where there would be a 50% grant available to them to enhance their cybersecurity capacity, both in training and in terms of technology. Because everything is connected in this country, and if there's an attack on one system, it can have repercussions right across our economy. And I think it's important that we take a far more robust approach in terms of cybersecurity, right from, as I say, the weakest link up to our state bodies. Now, Minister, the other point I want to make is that if we're going to use a health service, an electronic health service, that's based on connectivity, there's not much point having one of these things unless I can get coverage on it. And as you know, at the moment, most of the mobile operators in the country are turning off their 3G networks, which will mean that you know, some of these so-called smartphones will no longer be operable. The other problem with the 3G network, switching it off and moving to 4G and 5G, is that the coverage of 4G and 5G is poorer than 3G. You know, if you live in a rural area, and I live in the most rural constituency in Ireland, there are many areas that don't have access to 4 and 5G coverage. Now, we should be running our health service on a universal network. The emergency services in this country at the moment run on an outdated and very expensive Tetra system that's costing €40 million a year for old rope. And what I would like to see happen, and I know that the telecommunications companies in this country have approached government about extending the 4G and 5G network on a geographic basis across this country to every single townland in this country. And they reckon that they could do that for an investment somewhere between 50 and 80 million euro, which is 2 years of the cost of the Tetra system at the moment, a system that's outdated and has to be replaced. And I believe, Minister, what we should do is negotiate a deal with them to hive off part of that network to provide our emergency services, to provide the response to our ambulance services, to ensure that no matter where I am in this country, if I dial 112 or 999, I actually have coverage. And it would ensure that the emergency services have access to it. It would ensure that anyone seeking the emergency services have access to it. But it also ensures that individuals who now have their medical records on this device have and can give access to the emergency services should and when they need it. And I think, you know, if we take a more holistic approach to some of these issues, rather than just looking at this in isolation as a health issue or a communications issue or a cyber issue, I think we could dramatically transform our health service in this country, make it far more responsive, make it run far more efficiently, and use the money that has been saved to invest in many of the innovative solutions that are being put on your desk and on Minister Donnelly's desk from the staff themselves. Thank you very much.